There are changes happening to the Affordable Care Act, ACA, also known as Obamacare. These changes aren't just about politics in Washington, they affect real people, real families, and even the hospitals right here in Alabama. When Congress passed recent Republican-led healthcare changes, many of the cuts were scheduled to start in 2026. Lawmakers may have thought that pushing the dates forward would give people more time to adjust or avoid immediate backlash. Some of these delayed cuts included removing certain immigrant groups from ACA tax credit eligibility, cutting back on special enrollment periods, CEPs, that allowed people to sign up outside the normal open enrollment window, reducing subsidies that made premiums more affordable, Medicaid work requirements and redeterminations with many effects stretching from 2026 into the 2030s. What's actually happening in 2025? Even though many changes were written to start in 2026, some are hitting earlier, in late 2025. Special enrollment periods, CEPs, the low-income CEP, which let people under 150% of the poverty line sign up for coverage year-round, is being paused starting in October 2025. That means many low-income people will have to wait until open enrollment. DACA recipients. Young people with DACA status are losing eligibility to buy marketplace plans starting in August 2025. Premium tax credits. The extra subsidies from pandemic-era laws that lowered insurance premiums will expire at the end of 2025. That means starting with 2026 coverage, premiums will rise sharply for many. Insurance rates. Because of these changes, insurers are already filing higher premiums for 2026, which families will see when open enrollment starts in late 2025. Families will have to pay more for insurance or risk losing it. Many uninsured people will delay care until their conditions get worse. Without subsidies, thousands could be priced out of coverage altogether. What this means for providers and hospitals nationally. Uncompensated care. Hospitals must treat emergency patients even if they can't pay. More uninsured patients means more unpaid bills. Shift in patients. Doctors and hospitals may see fewer insured patients and more who can't afford to pay. Administrative burden. Without special enrollment options, providers lose tools to help patients sign up for coverage. Delayed care. Providers will see more patients with advanced illnesses that could have been managed earlier. Alabama-specific impacts. Alabama will feel these changes more sharply than many states because it already has one of the highest uninsured rates in the country and a history of rural hospital closures. Premium increases. Alabama insurers are already planning rate hikes of up to 30% for 2026 because subsidies are ending. Low-income families. Many families under 150% of the poverty line relied on the low-income September. With it paused in August 2025, they will have fewer chances to sign up. Rural hospitals. Alabama has lost 19 rural hospitals since 2005. More uninsured patients will mean even greater financial strain, possibly leading to more closures. Patient mix. Providers in Alabama, especially in rural areas, may see more uninsured patients who can't pay and fewer with commercial insurance that helps cover costs. Local communities. Small towns may lose hospitals or services like maternity care, forcing people to travel long distances for basic medical needs. When healthcare policies change, the effects aren't abstract. They mean a mom in Alabama may not be able to afford her child's asthma medicine. A rural hospital might shut down its emergency room. Doctors and nurses may struggle with heavier workloads while being paid less for the care they provide. What was supposed to start in 2026 is now partly starting in 2025, which means the impacts will arrive sooner than many expected. The ACA cuts are more than just numbers in a budget. They're decisions that will affect families, doctors, and hospitals, especially in states like Alabama, where the healthcare system is already stretched thin. We should pay attention to how laws passed in Washington directly shape the care our families and communities can access.